hygiene is the practice of keeping the mouth clean in order to prevent cavities. The most common disease actually around the world is dental caries. You know dental caries? What is dental caries? Is the black pinpoint or discoloration on our tooth surface. The most common disease, dental caries. And when there is negligence, still these dental caries will become dental cavities when there is already a hole. And then we have gingivitis, periodontitis, bad breath or halitosis, and other dental disorders. We call this oral hygiene. Oral hygiene consists of both personal and professional care. Dental x-rays or radiographs may be performed as part of routine professional examinations. Professional dental health care. So you need to visit your dentist, especially for the younger people. At the young age, at the age of 2, you go to the dentist and let your daughter or your son, your child, sit at the dental chair. Your dentist will not do the checkup. Let the child sit at the dental chair so that she will feel, or he will feel, the child will feel comfortable whenever you go to your dentist. But the problem sometimes is, when you want to frighten your child, oh, I will bring you to the dentist, and he will shoot you. And when the patient is already toothache, and he's very afraid because you use this. So sometimes you make us the enemy of your children. I'll bring you to the dentist if you will not shut up. When they see the dentist, oh, they're trembling. Even though if the dentist is good looking. Like my colleague, not me. So this is my clinic. Okay. So if you want to have dental checkup, I will do it for you for free. You just visit me in the Philippines, and I will do it for free. Personal hygiene, personal oral hygiene. Okay. So we now use soft bristle toothbrush. In the past, we want to use hard bristles because the former generation, they think that it is better to use hard bristles because they can brush everything. But the problem is the tooth structure is being destroyed, and also the gums. When there is a recession or the lowering of the gums in the neck area or the cervical area, it is one reason is because of wrong tooth brushing technique. Don't brush your teeth horizontally. This is a wrong way of toothbrushing. Parang dinalagari yung ngipin. You are like sewing your teeth. So at the younger age, I would like to remind you that fluoride is not a healthy, fluoride from the toothpaste is not a healthy fluoride. But the fluoride that comes from fruits, well, it is a natural one. So it is best if you can use non-fluoride toothpaste. We have organic toothpaste, although you can use fluoride toothpaste maybe one week in 1 month or twice in 1 month. But it is better if you just eat fruits and vegetables regularly and then you brush your teeth using non-fluoride toothpaste, because it was learned that fluoride is also a poison if it is not organic or not natural. Okay, that is another topic anyway. I just want to insert it. So, family that brush together stays together. Okay, just imagine your wife has bad breath. This is one reason why there is divorce. So don't divorce your wife because of bad breath. You bring your wife to the dentist. And also if your husband has bad breath, don't divorce. Okay? You bring him to the... Otherwise, you need to brush together. Because the family that brush together stays together. Okay? So, the cat can brush, hurt it. How come we people cannot brush our teeth? Yeah. And we are more intelligent than these animals. And this is my favorite poster. When this is for my patients, young patients, especially when they have bad set of teeth. And then I will show them, oh, you see, the monkey can brush the teeth. Why you can't brush your teeth? And I will ask them, what do you think? Is this monkey a female or male? They can easily answer female. Why? Because of the pink cup. But look at the toothpaste, it's blue. And then you start to think, okay, I'll just brush my teeth. Okay, that is how to do it. Dental floss. Okay, you do not insert the dental floss as far as you can because you will be hurting the periodontal ligaments. And from that point, there will be loosening of teeth sooner or later. So make it gentle. Okay, so we have these kinds of dental floss. And then we call this super floss, or those people who are wearing fixed dentures. We use super floss. This is a sponge floss with the end is actually a normal floss. So we insert this under the bridge. Because the bridge, they have what we call the food cleansing area, and sometimes the food is stuck in that area, so that we need to use this super floss. And then this is how we floss. Okay, you don't rush when you brush, you don't rush when you floss. And then these are the steps to successful brushing. Don't forget to brush the back of your front teeth, upper and lower. As I was telling you before, we need the full stroke on this area, full stroke. But in the front, okay, don't you ever try horizontal brushing. So this is the steps for successful flossing. This is what I am telling you before. This is an interdental brush. So you can insert this in between the teeth so that you can clean even the periodontal area. So this is what we use now. So you can buy this very cheap. Maybe you have also here in Thailand, and then you can put antiseptic, and then you insert it in your interdental areas. So this is actually the interdental brush. So you can use interdental brush instead of toothpick. Okay, do not use toothpick. So functions of the mouth actually, the teeth actually is for digestion and aesthetics. Okay. So just imagine again a picture without one front tooth or two front teeth or loose teeth. Well, speech. What healthy gums look like. Okay. So we call it in dental medicine coral pink. Coral pink. It's not color pink, it's coral pink. Okay. So when there is a reddening of this area, there is already a problem with bacteria. So it is good if you always brush your teeth. Go to your dentist. And do not frighten your children with the dentist, please. Okay, don't do it. Okay, healthy gums should look pink and firm, not red and swollen. Keep gums healthy, practice good oral hygiene. Brush your teeth at least twice a day. Actually, I recommend after eating. So if you eat 3 times a day, you brush. Okay. Floss at least once a day. Rinse with an antiseptic mouthwash, but natural. Because the mouthwash, actually the ingredient is alcohol, and this alcohol will burn our tissues, and our tissues are very tender in this area. And even our taste buds are affected with this antiseptic. Have you ever tried using antiseptics and your tongue is numb? Have you ever experienced this? It is because of too high alcohol content of this antiseptic. So, avoid smoking and chewing tobacco. Okay, so the bottom line on oral health, one thing is clear, the body and mouth are not separate. Your body can affect your mouth, and likewise your mouth can affect your body. Okay, taking good care of our teeth, gums, and gums can really help you live well longer. This means brushing twice a day, at least twice a day, flossing at least once a day, and going for regular dental cleanings and checkups. Okay, so I think you don't want to have this. These are oral cancers. Maybe I can show you some pictures. And do we still have time? Can I proceed with another? Or maybe we can listen for one solution, and then if we still have time, and then I can present hydrotherapy. Okay. Thank you very much.
Improve. Look at some. Được. Dạ, em
Hết mình định thử nghiệm thôi, mình đánh con.
không phải có nhiều cái không. Dạ, thôi anh uống.
Em sợ anh không hiểu.
Okay, the title of my song